This afternoon is going to be very helpful for everyone, even if we take away just one thing, and it's current top tips for parenting a child with CF. And of course we know that, as our first speaker said, I think it's 30 now before the frontal lobes all joined up and everything's functioning well, so this is very relevant for all of us. Oh, that was for boys, right. I'm Margaret Nichols. I'm a CF parent of 2 lads with CF from Wellington. 2 of my 3 sons have CF, and I now have a beautiful granddaughter to alleviate all those years of boys. And we're very pleased to have 3 panellists with us today, and they'll make a short introduction. They'll speak for a few minutes each, and then the floor will be open for your questions and your top tips as well. Jan Tate, first on my right here, is the indefatigable CF nurse specialist from Auckland Starship Hospital, the Children's Hospital in Auckland, and she's been there for over 20 years, nurturing and helping families with CF. She's absolutely wonderful, and she daren't retire or would all rise up in great protest. Next on our right is Dr. Mirjana Jaksic from Auckland Hospital, from Starship Hospital as well. She's one of 4 CF paediatricians. She graduated at medical school and qualified as a paediatrician in Croatia. As a young paediatrician, she looked after children with asthma, immunodeficiency and CF. Her master's thesis was in cystic fibrosis, immunology aspects of chronic pulmonary disease in children with cystic fibrosis. Since moving to New Zealand, she has been working in Starship since 1997. In 2001, she became a member of the respiratory team, and since 2007, she's been a permanent member of the cystic fibrosis team. Her current roles are a respiratory consultant in Starship and a senior teaching fellow at the University of Auckland. Some of her patients have met her in the latter role and have been a great help in teaching medical students, for which she is very grateful. We love to infect those medical students with a desire to help with cystic fibrosis, so they choose it as their specialty later. Tracy Richardson, on my far right, is a mother of 4 children, 2 of whom have CF. Tracy became a media tour de force when she decided to compete in the 2004 New Zealand Ironman. Awesome. And raised over $100,000 for the Breath for CF Fund, which is run by CF New Zealand. And that has formed a basis for many years of being able to provide funds for CF people in New Zealand at an annual, something like $300 a year, to provide with any physical activity, whether it's dancing or instruments or flat-out sports. It's been a wonderful resource, and great credit to her. Her book, Going the Distance, is compulsory reading for all living with and working for those with CF. So that's our panellists. So we'll invite Jan to come forward and speak to us on her top tips. Thank you.
Great. Good. Thank you very much. I know quite a few of you in the audience, so that's really nice. Hello and welcome to our session. As Margaret said, that I've been a nurse specialist for quite a number of years, and I've also got 4 children, 2 of my own and 2 stepchildren, and 7 granddaughters. So that's where I'm coming from with my top tips for parenting, as well as knowing all the little children growing up over the years. So I've put a couple of slides up, which are lots of words, and you probably won't remember any of them, but I'll just talk about a couple of them as we're going through, and I know that Mirjana will speak about some as well. And Tracy's going to give you some practical hints, and then we're going to answer questions from the floor. So I think the most important thing for everybody to have, and first of all, let me say that all people with parents with cystic fibrosis children do a fantastic job. It's not easy having children. It's not easy having a child with cystic fibrosis. So well done for having such lovely kids, and we see them when they come to clinic. They're all gorgeous kids. we're hopefully going to try and give you a few more pointers to make them more amazing. So first of all, positive attitude's the most important thing. So in ourselves, we've got to have a positive attitude which spills over onto the children, and taking good care of yourselves. So if you're a good role model of looking after yourself, we teach the kids having to do their physio, do their exercise every day. If we don't do our exercise as well, we can't expect the kids to do that. And so being good role models of positive attitude, doing things that we want them to do will help. And all these effective parenting skills, giving them boundaries and limits, I think that especially with little ones, little preschoolers, if they've got boundaries on what they do, then you're going to have kids that actually sit back and listen to you. I know that's kind of pie in the sky, but that's the theory of if you give them boundaries, yes, you can do this after you've done whatever you want them to do, or give them choices. You have to do your physio. Where would you like to do it? What time? Give them choices so they get more in control of their lives. Because these kids, we expect a lot of them. They have a lot of things they have to do that is out of their control. We have to put some control back onto them so they make good choices when they're older. Treat your child the same as your other children. So if you've got 2 or 3 children, one of them's got cystic fibrosis or even 2, you can't have the focus of those children with CF all the time on them. You've got to remember the siblings. Treat them all the same. Give them the same parenting skills as what you do with the other kids, just so everyone's on the same page. Now, can I go to the next one? No. Did it? Yep. Oh, yep. So that one up there I've got is patience. And I know that everyone has got different levels of patience, but if you get angry, you nag them all the time, which is what we all do. You wouldn't be human if you didn't nag, and I guess that all of you can recognise that. But then the kids, they misbehave and they're naughty, and you don't want them to do the things that they come out with. So you've got to have patience with them. And also the protection versus overprotection. We see a lot of kids that come to clinic. The parents are very anxious about infection, like you all are, getting infections from wherever. And some people go really over the top and some people don't. We like you all to be in the middle. We want you to be aware of it all. We don't want you to be so laissez-faire you don't care, but we don't want you to be over the top as well. So that kind of balance, which is really difficult. And give them accurate, age-appropriate information, and maybe learning from you first is a good idea. So when I mean age-appropriate, when they start asking questions, that's when you need to be giving them the information that they need to make good choices. That transition begins when your child's old enough to spit peas from the high chair. I thought that was quite good, because you're putting the responsibility onto them eventually when they get to be adults or adolescents and adults. They have to make decisions around their CF care if they're going to be doing it or not doing it. So you have to somehow make them understand that they've got to be in control of their lives and make responsibilities around their CF. And make it normal. I mean, it is hard to do all this stuff and not be normal, but they have to fit cystic fibrosis care into their everyday life. And don't believe everything you read. Some of that stuff on the internet is horrendous, and ask questions of the clinical team. We're all good, hopefully good fonts of knowledge. We've got the answers. If we don't, we go and find them out. And have a good relationship with your GP. That's quite a good tip as well. So, Mariana, would you like to say something?
Good afternoon, and thank you for having me again. I come from time to time to these clinics, and usually, usually talk about bugs, and I feel like a bug doctor. But this time they asked me to talk about something I don't know much about. But I just wanted to say a few things about problems I have seen in clinic working with those little kids, and I think it could be quite helpful for young parents especially. I see kids very early when they're 2 or 3 weeks of age, and it's a huge thing. It's huge once when you have to deliver news that the child has cystic fibrosis, and we start straight from the beginning with all our intense treatment. And this child looking very well, we start with enzymes, we start with physio twice daily, all this horrible stuff. And a lot of parents don't understand why we're going over top. I mean, child is fine, what we want to achieve. The whole point is we want to set up routine from the beginning. Once when you have routine, that's part of your life. When child gets older, bigger, they will take it as normal as brushing teeth every day or do whatever else they do every day. And I just want you to understand why we are sometimes maybe too tough, maybe not so flexible. That's not because we want to make your life harder than it is, just because we think with that regime will actually make your life easier later when they get older. That's one thing what I want to say. The other thing, what I noticed is school age. Once when kids start in school, a lot of new things are happening and new problems arising. Like enzymes. It's all right while they're at home, mom is doing that, everything's under control. But then when they start school, they have lunch break, all kids are playing, running around. They sit around and eating lunch, and they have to take enzymes, and no one else is taking enzymes. Of course, it's biggie, and they want to do that. Kids don't want to be different. They want to be same as the others. And we try to overcome that with few tips, what Jen knows much more than I do, and she actually helped a lot. Trying to make it more natural, trying to maybe sometimes mark a little bit enzymes, put them in different canister or with M&Ms or whatever we did, something like that, just to make CF child life easier and make them the same like the others. And that sometimes takes for a while. If you don't have cooperative teachers or people at school, it's very hard to establish a good treatment. And we do see very frequently kids when they start school having a problem with weight gain, problem with recurrent infections. All those are partially because compliance is not as good as it used to be when they were little and mom or dad were looking after them. Then we get to teenagers' age, when we have new problems, of course. You know, teenagers, all of them probably the same, and CF teenagers are the same, and they think that if they've got one pimple on their face, that's the end of the world. And can you imagine now we have to do so many things, what they have to do, and deal with those things every day, and no one else among those their friends is not doing that. What means we have to try to find options for that at work, and really try in clinic to find some options for those people and young teenagers. That's time we have a lot of conflict between parents and child as well. I'm not an expert, I'm not a psychologist, what means I won't go there, but I just think about medical stuff, medical needs, what you have to have. You have to have physiotherapy, we know that. There are some things are just not negotiable in CF, and good error clearance is something what we have to try to do. And having said that, if somebody sitting here from my clinic would probably say, like, but she sometimes says, okay, you don't need to do it every day. Look, what I said, depends how active you are, what do you do. If you are active running around the whole day after school, of course, you can skip this physiotherapy in the evening. And I personally think that's the way to go, because we have to adjust treatment for each person and personalized treatment. There is a lot of talk about personalizing treatment in recent cystic fibrosis literature, which means if something works very well for one person or patient, doesn't necessarily mean that the same thing will work very well for the others. And that's our role, I think. When you come to us and ask for advice, we should find out the best way how to optimize your treatment. There is many talks and there's many literature about compliance. Compliance means how well do you do your treatment what you're supposed to do. I've read recently a few papers when the people look at compliance with people who suffer any kind of chronic disease, not necessarily cystic fibrosis. And good outcome is if you do have 50% compliant. What means if people do 50% of things we want them to do, that's a good compliance. Which means we do know that. We do know that every patient doesn't do everything what we ask him or her to do. I mean, I have patients in my clinic who have list of medications, like 10 or 15 medications, and I do know, no way, no one would do that every day. What means if you do have that, you have to prioritize. You have to say, look, those and those are necessary. You have to do that. The others, negotiable. We can work around that to see what you have to do. And that's probably those little tips what we have to maybe help you with and see what is negotiable, what is not. In my opinion, and not just mine, everyone's saying that airway clearance, definitely, you have to do that. We have to adjust how often, how much, but that's something what has to be done properly, has to be done on a proper way. And for pancreatic insufficient people, they have to have enzymes, because without that, there's no way they're going to put weight on, kids won't grow, and we know that kids who have low weight don't actually do respiratory-wise well. The other stuff is a little bit negotiable. I sometimes adjust antibiotic treatment. If it's difficult to take 4 times per day, we negotiate 3 times per day and double dose in the evening. If it's very hard to do twice daily nebulized antibiotic, we maybe go once daily with double dose. There are no rules. Should be ideally twice daily, but you have to consider things like that to make life livable and enjoyable, because we have to keep those kids happy, otherwise they won't do anything. They're just little tips what I think we could talk about, and you can ask after questions and we can maybe tell you what we think about that. The last thing I wanted to say is when they leave us, they actually finish with pediatric clinic and they go to adults. That's the other big problem what we've seen a few times, that some of our kids are not mature enough actually to leave. They still depend a lot of parents and help, and in adult clinic they expect them to do everything by themselves. And there's the other moment in their life, and all of us would work together and try to help them to overcome that. I think it's very important that we work together, medical people and parents, because if we are on the same side, it's so much easier to get the child or patient on the same side as well. They're just little tips. You can think about that and ask later what you want to ask, and I'll try to answer if I know. Okay, thanks.
I had to have a bit of a chuckle when Kate asked me if I could do this. Top parenting tips. I said, well, I could speak for half an hour on all the things that didn't work. It's so much trial and error. You get given this baby, and none of us plan to have kids with cystic fibrosis. We didn't go out and say, I'll have one of those, please. Most of us got it as a complete shock. And so you start down this path that you've no idea where it's going, how it's going to end, and of course your brain does all sorts of things and thinks it's going to end really badly. And it's only now, with 22 years of cystic fibrosis experience, that I can stand here and talk about the things that didn't work and that did work. And oh God, I wish I had that hindsight. It came with them. I wish that Cameron, when he was born, came with this little manual and say, do this, or don't do this. But it doesn't work like that. So what I want to share with you today is a little bit of 22 years of hindsight, I guess. Knowing that some of you in here have children that are older than that, and some of you have got newborns. So everybody in here is in a different part of the spectrum. And that's the key thing, is that cystic fibrosis is a journey, and I will say that it is an amazing journey. I am really, really fortunate to have had cystic fibrosis come into our lives, because it has actually enhanced our life so much. Yeah, it's brought heaps of shit and crap and depression and all sorts of other stuff, but it also brought so much good stuff with it. So it's really important as parents to realise that you get given a child, that it is your responsibility to get that child to adulthood. And the reality is that now, nearly all kids that are born with CF make it to adulthood. And your job as a parent is to get that child from being totally dependent on you for everything to being able to transition into adult clinic and be responsible for their own cystic fibrosis, because it's not your cystic fibrosis. It is not yours. And that is the biggest message that I learnt. When my child was given to me with cystic fibrosis, I would have done anything to swap places with him. and her, because I got another one as well, I would have switched. I would have had the CF, and I'm sure most of you would have thought the same thing. And probably for the first couple of years, I took everything personally. If she got sick or he got sick, it's because I did something wrong. I hadn't done this, or I hadn't done this, or I didn't do the physio properly, or, I just hadn't done something. And it actually took me quite a while to realise that every time that child leaves my care, that cystic fibrosis goes with them. When they go to school, they take it with them. When they go to camp, they take it with them. When they go to nanas or aunties or anywhere, they take it with them. And when they become fully functioning adults in society, they take it with them. So my job was very much around giving them the skills and, more importantly, the attitude to survive and fight and be the best person that they could be who just happened to have cystic fibrosis. So knowing your part in the spectrum is really important, and your problems that you face as a parent with a newborn are completely different to the problems that you have when you have a 2-year-old and a 4-year-old and a 6-year-old, 10-year-old and a teenager. And when you have a child that is fully grown as an adult, your role completely changes again to become a support person. And if, like my child is on the lung transplant list, my role is completely different now. So knowing where you are and knowing that that stage is going to evolve into something else is actually a really good thing, because, as they say, this will pass. If you've got a child who's 2, who's stroppy about doing physio, well, it is going to pass, because when they're 10, they're going to be stroppy about a whole heap of other stuff as well. I can't emphasise enough about attitude. Giving your child the attitude, it really only comes from one place, and that's from you. Children learn and observe and watch, and the way that they deal with their CF and the way that they think about their CF and the way that they approach it and they project it to the world, whether they have a victim mentality or this is the fire that will actually motivate me onto greater things, it all comes from you. So when you are dealing with these issues, the way that you deal with them will be reflected back to you in the way that the kids deal with them. And to that end, it's really important. One of my biggest parenting tips, I often get asked to talk to newborn parents. Parents are newborn, you know what I mean. Is, how do you get through this? Look after yourself. You have to look after yourself. You are in this for the long haul. This is not just a 6-month job. And you can easy burn out doing this. But you have to take an 18 to 20-year view on this and go, I've got to be there for that child for that whole time. Not doing things for the child, but supporting the child. And gradually, over that period of time, empowering them so that when they get to that adult stage, they can carry on the good work, the good foundations that you've done. By looking after yourself, I mean you need an outlet. You need to find people that will support you, both in your partnership with whoever you're with, but also outside of that. I'm a great advocate of counselling, psychologists. Go pay someone and cry in their office and leave. It's great. The other thing that my own personal view here is that I viewed my role as the conductor of an orchestra. It's actually quite appropriate standing here, isn't it? I could not be the physio, the doctor, the psychologist, the CF nurse, all the parts of this big team that were looking after the kids. But what I could be is the person who made sure that everybody was playing on the same tune and playing the same game to look after that child, and make sure that I kept, not the control isn't the right word, but I was aware of what was going on, and that if somebody else was, maybe the physio was saying things that didn't make sense to the overall treatment plan, that I brought that back under control again. My role was very much about empowering the child to play within the orchestra to the tune that they wanted to play and make sure that everybody else around them was playing the same tune. Other tips would be very much about fight the big fights. With CF, there will always be things that piss you off. Always. Be it kids, be it medical staff, be it doctors not turning up when they said they were going to, be it just, endless blood tests, being scheduled for theatre and being nil by mouth for 6 hours only to be bumped off the list. There's heaps and heaps of stuff, and we've had our fair share of it. But fight the big fights. Pick the things that are really, really important, that are core values for you, things that are really important for the child, and stick to those. And those are the things that are not negotiable. You'll save a lot of energy. When I knew I was talking today, I went and asked a whole bunch of CF adults about what they thought were top parenting tips. And it was interesting because it was fairly unanimous what I got back from different websites and forums and groups. And some of it Jan's already talked about. They all want to be treated normally. If they've got brothers and sisters that don't have CF, they don't want to be special. They want to be special at school, they don't want to be special as adults, they don't want to be labelled, they just want to be treated normally. They want to be empowered. They want to be able to have a say in their own treatment and in their own decisions. As Jan was saying, Mariana was saying, that physio is not negotiable, but they do have a choice over where they do it, how they do it, what time they do it, and maybe over how often they do it in terms of they're allowed to have one session off. Which session in the whole week would you like? So allowing age-appropriate choices, and obviously the closer you get to 18 or 20, the more choices that they have in those things. And virtually everyone was thankful for the attitude that got instilled in them by their parents. Often it is the children who are the most ballsy and who fight and who kick up the biggest stink and who, in my case, locked himself in the toilet when he should have been having IVs, and we had to break the toilet door down to get him back onto the ward again. It's those children that actually have the fight and the spirit that will keep them through. So even though they're testing you, even though they're pushing every single button, those are actually the children that you want, because they're the ones that will fight and survive. A couple of people have asked me for some uber practical things about how do you do this and how do you do that. And I was talking to Jan outside and she said, I just should share them. One of the things I would recommend is just be as creative as you can with your treatment regimes. There are no rules. Nobody says you have to do it in a certain way. And one of the things that we did with kids before they could swallow enzymes is we'd get the bottle of enzyme and I'd take out 20 or 30 of them, empty them, and then I'd refill them with hundreds and thousands. Put them back into the bottle, shake it up, and it was a lucky dip. And whenever the kids would open their enzymes and put them onto their food, every once in a while they would get a rainbow one. Oh my God, it was like Willy Wonka and the Golden Ticket in our house when that happened. It was like, can I have another one? Can I have another one? And it was just great. And they still remember that. I'm a great believer in bribery and rewards. So we had this thing, I asked the kids what they remember about this, growing up, and they said the brown bags. I went, what do you mean the brown bags? Well, apparently, I can't remember a lot of this, but apparently for about a year, I got brown lunch bags, things like American lunch bags. I stapled them closed, and inside there were little rewards. And they would sit on top of the fridge for the whole week. So I'd fill them on a weekend, put them up there, and they were allowed them after they'd done XYZ number of treatments or whatever. But because those things, you could not see what was in them, and they sat there with their name on them all week, they wanted them. Now, I remember that they had things, sometimes they'd have a movie ticket in it. Sometimes there'd be a voucher for an extra session of physio. Sometimes they would, I know, big reward, it cost me nothing. Sometimes they would have food. Oh, Cameron would do anything for food. They would just have all sorts of things. It would be a night at Grandma's. It could be anything. But the fact that there was a tangible reward there, and because later on I had kids without CF as well, I would have to have those up there. But their things would not be about doing their physio. It would be about making their beds or other things like that. So again, it was normalising it. Later on, we got into negotiating and contracts. Seriously, contracts. It was a 13-page document, I think, from memory. He was 14 at the time, and there were a lot of things he didn't want to do. And so there were a lot of things that he wanted to achieve and do in life as well. So we negotiated a contract. And he still talks about that contract, how he had say over what could and couldn't be done to him. It was about processes when he had his Portacath accessed, about how he only wanted the staff to do it in a certain way or certain staff doing it. And I included the CF nurse in there at the time, and we all wrote this contract about Cameron's treatment and how he was going to comply and what all the rewards were. So it did get to that extreme at one point. But at the end of the day, I've now got a 21-year-old and 22-year-old adults who have got the most amazing attitude to life. CF is just this much of who they are, and they are out there kicking ass, doing such a great thing, and living and travelling, and one of them self-employed, just brilliant, and very, very proud of them. So even though there were a lot of things that didn't work, a couple of things must have stuck.
Thank you very much, our panellists, for those wise words. We can open the floor now for discussion and for questions. My first question is, I'll just start the ball rolling with Jan. Is it okay to have, like if you're going on holiday to Fiji, can you sort of leave doing physio at home? Or like if you're getting married one day, can you not bother with your treatment that day?
And be married once.
So what you're saying is, can you leave physio one session in a week or whatever?
Yeah, or
Is that
from
what
time
you
to
mean?
time.
Time to time. Yeah, I think, because when you're on holiday, you're doing extra special things activity-wise that you'd be doing in place of your physio anyway, wouldn't you? I think, physio is a thing that, it's like mucus and CF lungs. It's just like the rust that never sleeps. It's always there. You just have to get rid of it. So if you choose not to do physio on one particular day or a couple of sessions, that's okay, but the next day or the next week you're going to be having more mucus in your lungs that you need to get rid of. So once in a while, miss physio, sure, but it just has to be done. And I think going on holiday, you can miss it a couple of times, but put it into the regime. That's what I'd suggest. That's me. What do you think?
I remember our beloved Erin Bartram from Wanganui. She took a Ventolin inhaler up in her wedding bouquet to get up the aisle. Are there any thoughts or questions you have? One over here.
Hi, I'm Robin. First of all, I just wanted to say a big thank you, especially to Tracy. Hearing another parent and how you did things is always inspiring, and I think you do fantastic. First of all, you spoke about the attitude, and I think a lot of other places that we've been this morning have spoken about it as well, trying to instill that attitude in our children, and that's something that I think that I personally struggle with. You're constantly trying to make sure they do these things, and at the same time be positive about it when it's just doing your head in sometimes. I have nothing to offer, but if anybody else does, I just know that that's my hardest struggle, is just keeping it positive. And my son's 6, and he said to me just the other day, why do I have to have CF? And I don't have an answer for it yet, so if anyone else does. So just that, hearing you talk about that positive attitude, obviously something that I really want to work on, and thank you. Yeah.
Got a red light show.
I think it was already on.
Is it already on? No.
You can talk loud.
Here's a pro.
I think it's okay to not be positive at times. It's actually okay to not cope at times as well, and that's a really strong message. everybody is allowed times to actually not be positive, because it's shit sometimes, but we're talking about in the overall big picture. I think there's that having that sort of false positivity is probably quite damaging, but having a general positivity, you know, that the messages, especially for kids, is that what we're doing is getting you to be an adult where you have a lot more choices.
Hi, Tracy. I think you highly achieved your great attitude, because we had the pleasure of meeting your son, Cameron. He was the first cystic fibrosis person we met since our son's diagnosis. And you just never know. He was amazing, and his name is now a often, sorry, very inspiring name in our household. And whenever I'm having a dip, I'll talk to my dad on the phone and he'll say, Cameron, what's Cameron been up to lately? Because I'm friends with him on Facebook.
Yeah.
You know, he's done his Camp America. He's off in the outback somewhere doing filming at the moment. And he is someone, whether Cameron likes it or not, that is going to be a mentor for my son.
I think there's an important message in that when you have got newborn children, you should give yourself hope by seeking out people, adults with cystic fibrosis, because it's really hard to see through the trees. When you meet an adult with cystic fibrosis, it suddenly changes your whole perspective, that from being, oh my God, I've got a really sick person who's going to die on me any minute, to going, holy crap, my child's actually going to become an amazing adult and is going to have a career and is going to get married and fall in love and all of those things that you want for your healthy children. My child with cystic fibrosis is going to have that as well. And as soon as you believe that, you can start instilling that in your children as well. And then it's the pay it forward. They can meet, and now Leo can do the same thing.
Thank you again. We've had some very positive messages from Cameron, and he's amazing. So, and that's to you. So thank you.
We can also think perhaps there's time to think about the siblings as well. Is there any top tips for siblings with who have brothers or sisters with CF? It's another area that would be helpful for those of us with the mixed families. This is Robin Somerville from Auckland.
Probably a tip from my 23, 24-year-old daughter who doesn't have CF. One of the things that really annoyed her growing up, she wouldn't have swapped roles with Vaughan at any one stage, but whenever anyone came round, the first question they asked when they walked to the door was, how's Vaughan? So maybe just an education for our parents and our friends and our aunts and uncles is that, in our case there were 2 children in the house, and she felt that at times that she didn't exist, and that was, even though we always tried to involve her in everything, that was something that we had no control over.
Yeah, I've heard that quite a lot, Robin, from siblings where families would come to the hospital to visit a sick child and bring a gift for the sick child, and the well child who's there or who is not there but is still part of the family misses out. And I think it's just because people aren't aware that that's a sensitivity. So as parents, one of the things we can do to alleviate that for the siblings is to actually spread that word and say, part of my view of the family is I want the kids to be treated equal. So if you're going to do something for one, doing it for the other, well, don't do it at all, really.
Sorry, just one thing. We've been thinking about that because I think, and Jane agrees with me, we actually neglected siblings, and it's not the way to go because they are part of the picture as well. And our plan is, as soon as we are able to organize that, to get siblings and do some kind of education with them, whoever is keen to do that. I'm not saying everyone has to participate. And see, does it help in the relationship with sibling or parents or whatever? Because there was a study done outside New Zealand with huge improvement in interrelationship between siblings and parents, because CEF team was working with sibling, not with the sick child. And as soon as we get time, we promised we will get into that in our clinic, yes.
Great. What I was going to add to that was, if I could give you any advice, would be to have time out with your other children. With kids with CF, there's a lot of closeness, physical closeness with that CF child, and the parents spend a lot of time, you know, twice a day or whatever, being with the kiddie, doing the 20 minutes physio, and so some of the siblings get a bit jealous of that, I feel, and what I've spoken to them about, and I think that making time out to take them somewhere special, take them to a movie, just the two of you or the three of you, and leave the CF child with dad or mum or whatever, with grandma, but having special times with the other children is really important, I think.
Oh, we've found actually a little bit of the opposite, really, because she's been quite well, but her brothers and sisters go on sibling camps and sibling day activities, and she's always like, I'm the one with CF, I put up with all the crap, and what do I get back? Now that, you know, that she has no peers, CF peers of her own, but, you know, her siblings do quite well with all the camps and everything organised for them.
That's wonderful. In New Zealand, we're a wee bit small, and we've thought about sibling camps. We've heard about them in Australia, and we would have, we've thought about it. And Kate, do you have something to? No.
Parent to Parent here in New Zealand run a very good SIB support program, and they run sibling camps. Sorry, I've got my back to half of you. So whilst we don't do them, and whilst those camps are not CF specific, sometimes there's actually quite a lot of benefit in going to a SIB camp where there are siblings of people with other conditions as well. They get a slightly broader view as well. So it is available here, and anyone in New Zealand who wants to link into that, we can give you the right numbers for that.
In Wellington, we provide vouchers for our young people who go into hospital so that they can have internet access and are able to access Facebook and their peer group while they're in hospital. Did that make sense? Yep. Oh, thank you. Here.
Should have put my pedometer on today.
I can't help myself. I've got to wonder about the top tips, what not to do. Some of the ones that, you know, people might think to do but turned out weren't the best way.
God, where to start? I think it's very child specific, and over a course of a few years you get to know the buttons that push for your child. And I know with Cameron that going head to head with him on anything, I was on a hiding to nothing and would always lose. So I think for me it was around getting to know his style and the way to get the best out of him, and very much I could not go and say, you will do this. Whereas with McKenna, absolutely, I could do that. You know, I could threaten her and she'd do something, but Cameron would just get dig his toes in. So every child that I know with CF has a way of getting the best out of them, and yeah, you've just got to, even in those times of huge stress or when things are crumbling around you, keep on the way that works as opposed to going back to the way that you want to do it. You just have to alter your parenting style to the child, not the way that you necessarily think it should be done.
Just add one thing from a medical point of view. Try not to undermine us, because we really have the best interest of your child. And if child gets one message from me and different message from you, that's not going to work, definitely. That's a little bit from me.
Yeah, I was just going to say that things not to do. One thing would be not to nag. You know, everyone tunes off with nagging. And so if you want them to do something like their physio, because that's just like an everyday thing, if you nag them all the time, they won't do it. So you have to find creative ways of how your child works, as Tracy was saying, to get them to do what you want them to do. So put the control in their hands. It's like when they have to have a blood test. We talked about this last year at the conference, how to get kids to go through procedures that they don't want to do. Give them choices. Give them, this is not negotiable. You have to do it. How are you going to do it? And so let them make the decisions. I think that's quite a good thing. But nagging doesn't work. So that's one thing don't do.
We had a psychiatrist when I lived in England, and he said, physio's not negotiable, but so let them dye their hair green, as long as they keep doing their physio. My eldest son is very competitive, and he used to go to school when he was 6, 7, and say, at lunchtime, get his lunchbox open and say, look at me, I can swallow 12 pills at once. And down the hatch they'd go, whereas my younger lad with CF, he was very secretive about it and had to have a star chart with the teacher. How have people found schools? Some schools are very difficult they don't want you to have medications in the lunchbox, and I don't know how it is in Australia. In New Zealand, I think it's a bit variable between schools, what you're allowed to do, what rules there are.
I don't know about rules, but one thing that we found very helpful and very easy, actually, is every year we would go in and meet with our child's teacher. They had a great appetite to understand the disease, because in most cases they really knew very little. They would often attend information sessions at our CF Association, or at PMH. So there would be a great appetite from them to learn, and I think some of the do's and don'ts came across much more assertively because it came from her parents. Things like, if Marina says she wants to go to the toilet, she probably really needs to go. Things like that. So we found that very helpful. Yeah.
We have a leaflet, I believe, that is also helpful, so teachers know that a cough is not an infectious thing necessarily, or not between your child with CF and an unaffected child.
Some of the children don't like to take their enzymes at school because they don't want other kids seeing them take them, because it is a little bit different from their friends. So we've suggested to the parents they put them in a little raisin packet or a little M&M packet, and then they can just open the packet and swallow them down before they eat their lunch, and that seems to work well with a lot of the children.
Hi, is this working?
Yes.
Yep, I'm Tina. I'm from the Gold Coast. School's fine. We've got a really great school that helps out heaps with the kids, gone above and beyond. My youngest daughter, both my children have CF, by the way, they're 8 and 11, and the younger one also has an eating disorder, and absolutely everything goes down the gastrostomy button. So enzymes, everything that shouldn't go down there does. But yeah, I kind of find what's interesting is I'm still trying to get over your comment that had me in tears, which was, it's not your CF. That just hit me like a ton of bricks, and I got quite emotional about that, because you feel like it is. Like it's just all consuming. Whether you like it or not, it runs your life revolves around it, you plan around it, all that. But what I find interesting is that from one person to another and from one hospital to another, you can get different advice. I've had advice from, just doing physio once a day is enough, to, no, you must do it every day, don't ever miss a day. And, you already feel like you're going insane from the day-to-day things you've got to do anyway, and then you get all this conflicting information from doctors, physios, everyone else. And so at the end of the day, I think you've just got to do what works well for your family and your child and what you can deal with as a parent. Because I know that if I miss a day of physio, I won't sleep at night. I'm one of those mums. I'll just be lying there thinking, I didn't do physio, and what's that going to mean, and are they going to be okay? And I just know that if I don't do it, I'll probably be I'm a bit neurotic like that. But also we did trial it. We let Christmas last year, where we didn't do the kids' physio at all for the day, We just thought it's Christmas, we're going to let them have a day where they don't have, we're just going to enjoy them, we're going to enjoy the day. And my younger one was fine, no worries, but within a couple of days, my older one was, it was not good to not do it for the whole day. So we've found that, okay, we've learnt the hard way that she can't, and she knows too, so she now doesn't actually want to go without doing her physio because of how bad it made her. But yeah, I just think it just highlights that you've got to do whatever works for your family and what you can live with. Same as when you go to clinic and they say, okay, now you've got to do this and you've got to do that and and you're thinking, are you going to give me the extra bloody hours in the day to fit all that in? You know, like, and when do I get time to have a cup of tea? And, you know, so I think the whole flexibility thing too, but also being okay with that inside as a mum. You know, like, oh, but if I don't do that, will that really be okay? Because it's a whole quality versus quantity. Because at the end of the day, as a mum, you want the quantity, but you want the quality as well. So it's I think our kids deal with it much better than what we do. Am I the only neurotic person that lies awake at night worrying that I didn't do?
When I said that the cystic fibrosis isn't yours, I meant the disease, the underlying condition. Yeah, the responsibility is yours. And my two CFs are only 11 months apart, so I had two very sick children very close together who had a very difficult young, early childhood, and my marriage split up at that time, and it was absolute shit. But it is your responsibility. But you have all those responsibility as a parent anyway. I mean, you've taken on these children. This is something that is extra to it, but that over the course of the years needs to get handed to them, because when they leave, they're taking it with them. And the time does come when they do leave, and it's beautiful.
Yes, thank you.
With the CF isn't yours, you've got to own the grief. The grief is yours, and you know, I think that's a big part of it, is that people don't talk about, is the living grief.
Yeah, I liken it to a chronic sorrow.
Yeah.
It never goes away. It took me a long time to realise that I was living in perpetual sorrow, and grief is actually is a good word, but I don't think it's appropriate for CF. That's my personal opinion, because grief implies the grief cycle that'll be resolved. But with sorrow and the chronicness of it, it doesn't go away. It's there for years and years and years, and it's about finding ways to cope with it and owning it, and moving through it.
Our son is just about to start high school. Primary school's been pretty good. He's very responsible with his enzymes, and there's usually only one or two, possibly three teachers that you have to give the brief to about hydration, let him manage it himself, etc. Next year he could have 12 different teachers. Any pointers on, I mean, I'm quite prepared to go and talk to every single one of them, but I'm pretty sure high school teachers don't want mum and dad in their face. So any points on high school transition?
Does the school have a nurse? It has no nurse facility or a matron at the school or anything like that. Both of the schools that my children went to had a matron, because they were boarding schools, although my kids didn't board, and they had a nurse there, and that became the point of contact for us. One of the children decided that they wanted their classmates to know, and I went in, and with her we did a talk, and everybody found out about it. But one of the other kids decided they didn't want the school to know. Didn't care whether they found out, but didn't want to make a presentation of it. So I think my opinion is take your lead from your child to start with, as to this is part of a new start for them, and a new chapter in their life, and about how they want it presented and how they want the teachers to know and be involved, and that's all around the communication of it and being them having some choices in that. And by the very fact that you're asking their opinion, they'll be forced to think about it and to acknowledge it, and they'll decide who they want. But there'll be other people that have gone through that with some experience as well.
You'd also... sorry. No, you go.
I was just going to say, is there maybe most schools have like a dean or a person that's in head of all of the 12 or 15 other teachers that the child will have? So
a form class teacher.
Yeah, so a year teacher that you can go and have a conversation with and take the news from the clinic or somebody from the hospital with you, and so they can talk about what cystic fibrosis means to the child. Yeah, very important.
Just on that, we had a lot of fears when our daughter was going to high school because she was coming from a really small school of about 60 children and going into a school of around 1,200, so it was a big transition. One of the things that I found the best and the easiest early on was I just got a little business card and I wrote on it with a nice little smiley face, I have cystic fibrosis, and on the reverse it had things that I need hydration, different things about, if she needed to go to the toilet, and the headmaster signed it for us. We had it laminated, and then when my daughter, if she needed to go to the toilet and didn't want to interrupt the class, she'd put the card on her desk and leave, and all the teachers were aware of what that meant. Or if they saw her and she wasn't doing something that they thought was quite right in the playground, she'd simply give them the card. She didn't have to go into great explanation as a Year 7 and be different than everybody else. So we found that card worked really well, and the headmaster became our point of contact. So it wasn't a matter, and it was his job to educate everybody else. We did go in later and have a chat at a staff meeting, but just that card was just a really good tool for her. She's very shy, was very shy, for her to be able to just communicate what she needed, and we found that worked really well for us.
Thank you. I think there's time for one more.
You are going to hear today at this meeting too from about a national project for Australia, which we're sort of hanging on the coattails of, really, that's been led by Western Australia for the development of a program for schools, an education program. So, you'll be hearing about that as well.
Was there
Last
one more?
One more?
Going. Go. Well, thank you very much to our three panellists. Your cogent observations and your wise words are very much appreciated, I'm sure, by everyone here, and I'm sure everyone has something to take home with them, some life-changing. We have gifts here for our speakers. We're holding Jan to ransom. She doesn't get hers till she's performed tomorrow. So to Mariana and to Tracy and to Jan, thank you very much.